remember like it was yesterday, 2002. I had everything going for me. Money, women, weed, alcohol, you name it. Then I started having these visual problems. Didn't know what it was. Come to find out, I'm a diabetic. I developed diabetic retinopathy, and now I'm blind. All I got is my bud Charles and my buddy right here, Joe John.
And who can say why your heart cries when your love has only time?
Just think, if I only would have checked my feet.
I didn't know diabetes could lead to a stroke.
Who can say when the roads meet that love?
I thought I had it under control, but apparently not.
In your heart, and who can say when the day sleeps if the night keeps?
My grandma had type 2 diabetes. She used to never check her blood sugar. She ate whatever she wanted. Top ramen, ho-hos, and ding-dongs. Then she died. Who knew you could die from type 2 diabetes?
Hi, my name's Sally Novalog, and thank you for tuning in to 7030 Medical Evidence. Tonight's episode is all about type 2 diabetes. What is it, how it's treated, and how you can determine if you are or will be a victim of this terrible disease. Here with an exclusive interview at the home of renowned endocrinologist Dr. Heigl is Officer Martinez with the Diabetic Police Department.
Thank you for that, Mrs. Novalog. Thank you, Dr. Heigl, for letting us in your home to discuss a very important topic about type 2 diabetes. Now, to answer the serious question, what is type 2 diabetes?
Well, thank you, Officer Martinez, for being here. It's a pleasure having you guys here. Diabetes type 2 is the most common form of diabetes. It's characterized by your body not producing enough insulin or not utilizing insulin in the right way. And if you're at home right now and you've been diagnosed with diabetes type 2, don't feel alone. In fact, diabetes has been diagnosed with about 25 million Americans right now. And in 2010-2011 alone, about 4 million new cases have been diagnosed. So you're definitely not alone.
Wow, Dr. Heigl, that's a lot of people with diabetes. I may be at risk. So, Dr. Heigl, can you tell us what causes diabetes?
Well, that's an interesting question. See, insulin is a hormone that's produced by the pancreas. It acts as a key for your blood glucose levels. Your blood glucose is actually just sugar that's in your blood. And when those levels are high for prolonged periods of time, your body shuts down and no longer uses insulin the right way. To better answer your question, the exact cause is unknown, but we do know that being overweight and inactivity contributes to those factors. Also being over the age of 45 and certain types of races such as African Americans, Hispanics, and Asian Americans will put you at a little bit higher risk.
Wow, insulin seems pretty important. Can you tell me how I could tell if I have type 2 diabetes?
Well, that's another great question. See, signs and symptoms may vary and they may happen suddenly or slowly. The three classic symptoms we have are what we call the 3 Ps. You have polyphagia, which is excess hunger. You have polydipsia, which is excess thirst. And then polyuria, which is excess urination. Other signs and symptoms may vary from fatigue to weight loss, and then another complication can also be slow wound healing.
Was that guy peeing in the pool? I never knew there were so many complications for type 2 diabetes. Well, thank you, Dr. Heigl, for all the great information.
Well, it was a pleasure having you here. Anytime you have any questions, feel free to ask me, or you can go on my website at www.drheigl.com. Thank you.
Now back to you, Sally Novolog.
Thank you, Officer Martinez and Dr. Heigl, for that thorough breakdown of type 2 diabetes. When we come back from a short commercial, we will be talking with lab technician Stephanie Mock. She'll be discussing labs and diagnostics with us. Stay tuned. Hello, and welcome back to 7030 Medical Evidence. Now we're here with lab technician Stephanie Mock. How are you doing, Stephanie?
I'm doing well, thank you.
Glad to have you here.
Thank you.
And Officer Martinez, hello.
Hola, Miss Novolog.
All right, let's get started on some labs and diagnostics. So what are some of the tests, Stephanie?
Well, we have 4 different tests to determine whether or not somebody has diabetes. There's the fasting blood glucose test, there's an oral glucose tolerance test, and the hemoglobin A1C.
You forgot about that random. Can you tell us something about that random glucose test?
Thank you, Officer Martinez, for reminding me of the random blood glucose test.
So, Ms. Mock, can you explain for some of the viewers that don't understand what these tests consist of?
Sure. First test we'll talk about is the fasting blood glucose test. This test is done after an overnight fast. If blood sugar level is less than 100 milligrams per deciliter, your blood glucose levels are normal. If your blood glucose test comes back 100 to 125 milligrams per deciliter, this suggests prediabetes. Anything over 125 milligrams per deciliter on 2 separate tests is positive for diabetes mellitus.
Thank you for that, Mrs. Mock. I didn't know I had to do it twice.
Well, now that we know about the fasting blood glucose test, what's some other ones?
Well, there's an oral glucose tolerance test.
And what's that one all about?
Well, this is a test that's done after an overnight fast. A patient will be given a sugar-based liquid, which they'll drink, and the blood sugar levels will be measured periodically through the day. And a blood sugar level less than 140 milligrams per deciliter is normal. A reading of more than 200 milligrams per deciliter after 2 hours indicates diabetes.
Wow, that's amazing.
Hopefully that tastes good.
I imagine it's pretty sweet, Officer Martinez. So let's go ahead and move on to the hemoglobin A1C test, Stephanie.
Well, the hemoglobin A1C test is a test that averages your blood sugar levels for the past 2 to 3 months. The test works by measuring the percentage of sugar attached to your hemoglobin. The higher your blood sugar levels, the more hemoglobin you'll have with sugar attached. An A1C level of 6.5% or higher on 2 separate tests means you have diabetes. 5.7 to 6.4% are indications of prediabetes. Anything below 5.7 is considered normal. And the last test we'll discuss is the random blood glucose test. This test is a sample that can be measured anytime, regardless of when you last ate. A blood glucose level of 200 milligrams per deciliter or higher indicates diabetes. Just remember, the normal blood glucose level is 70 to 110 milligrams per deciliter. However, each test that we just talked about have their own parameters.
Miss Mock, do you mind showing me how to check my blood sugar?
Sure. What I have here is a glucometer,
Okay.
a lancet, and an alcohol swab. What we're going to do is we're going to place this in the machine.
Your prodigy-meter is on.
Let you know it's ready.
Okay.
We're going to prepare the site with some alcohol.
Okay.
Blood into the test strip.
You go like this, and we take the lancet
Okay.
on the side of your finger.
Okay. Oh,
Doesn't hurt too much.
no, not at all.
And then
Testing.
put the blood there.
Okay.
Here's a napkin for you.
Thank you.
Blood glucose. 52
Now, is that good?
per deciliter.
No, that's low. That can put a person in a hypoglycemic state.
What do I do if my blood sugar comes back that low?
Well, a good immediate action would be orange juice. That would
Okay.
be the best thing to do for that.
Oh, okay, good.
Yeah.
Thank you, Stephanie, for being here with us to show us and tell us all about the labs.
You're welcome.
Now we're going to go to a few short clips that shows what people might look like or experience with hypoglycemia.
Now we are going to talk about what can happen to you if you are hypoglycemic, like Miss Novolog. You can suffer from irritability or anger, diaphoretic, which is sweating, hunger, or dizziness. It's very important to monitor your blood glucose. On the other hand, if your sugar level is too high, you can suffer from hyperglycemia. And these symptoms are extreme hunger, hot, dry skin, and fruity breath.
Remember to observe for signs and symptoms of hypo and hyperglycemia. If you think you may be experiencing any signs and symptoms of hyper or hypoglycemia, please report to your physician immediately. Now let's take it to Jasmine Henry, where she will be discussing preventative measures and complications of diabetes type 2.
Thanks, Miss Novolog. Now I'm here with L-Dub. L-Dub, do you have any questions for me?
Yeah, I'm kind of confused. I just want to know, like, the complications of having diabetes since I just found out. And, like, I don't know how to do anything. Will I die if I have diabetes? And how do I check my insulin? And how do I give insulin? I just don't know. It's so complicated, this diabetic stuff.
Okay, L-Dub, let's start with some complications. The main complication with diabetes is foot care. You have to check your feet. That's the number one thing to do.
My feet.
Your
Oh,
feet,
man.
check in between your toes, check the bottom of your feet.
Both of them?
Yes, both of your feet. Because it can start off as a simple cut or a simple blister, but it can become infected. Since you have diabetes, you're prone to infections,
Oh.
and you will not heal correctly. And also, another complication is neuropathy, meaning you have loss of sensation in your limbs, you won't know if there's a cut or if you stepped on anything with your feet, so you must check your feet.
So I take it knowing all my foot care precautions is important because I can get really sick if I don't check them.
Yes, your feet, if you do not check your feet, it can turn into a more complicated problem. You can get your toes can be cut off, legs, if it gets gangrene.
Okay, I'll be sure to check my feet every day. I also heard that I can have really bad heart problems and that my heart will be affected very bad if I don't manage diabetes the correct way.
Well, L-Dub, that's a very interesting question. While you have diabetes, it increases your risk of having a stroke, heart attack, and hypertension. And you are 2 to 4 times more likely of having a stroke because of your diabetes, as well as having more heart complications because that you have diabetes.
Oh no.
And another important complication is your eyes. Since you can get eye damage from having diabetes, it can lead to blindness, and it can also lead to cataracts or glaucoma.
I'll lose my vision?
Yes, you can lose your vision for having diabetes.
Oh no, not that.
Yeah, you must have your glucose levels under control.
So, how do I prevent my heart and my eyes and my feet from being messed up from diabetes? I want to prevent all of it. How do I do it, nurse?
Well,
you know?
the key is healthy eating. You must eat a lot of fruits and vegetables.
No, I don't like fruits and vegetables.
Yes, you must eat healthier. If you're not going to eat fruits and vegetables, try to substitute your beef for lamb chops.
What?
Another important aspect of preventing diabetes is exercising. You must exercise 30 minutes a day, at least 3 times a week.
That's one of the things that I can do all the time. I love working out.
Well, that's great you love working out. Also, if you are obese, you must lose a good amount of weight.
Am I obese, nurse?
You don't look it to me.
Oh, okay, good. Are you gonna help me learn how to do the insulin stuff? 'Cause I get so confused.
Yes, let's walk over here to the table.
Okay.
Okay, so first you're going to open up your syringe.
That big syringe?
Yeah. You're going to check your insulin, make sure it's the correct insulin.
Okay.
You're going to take your alcohol swab the top off,
Okay.
take the cap off the needle. You're going to inject the amount of insulin that you need.
I just don't like that syringe. I'm scared of it.
It's okay.
Are you sure?
Mm-hmm.
Oh.
Inject the amount of air as the amount of insulin you're going to draw back. So we're going to draw back 2 units.
Oh, this is making me nervous. I just am nervous. Should
Okay.
I be scared?
No, you should not be scared.
Okay, I guess.
And another important thing is you want to make sure you're drawing up the correct amount of insulin. You don't want to go into a hypoglycemic state. Hypoglycemic state.
Oh, okay.
That means low blood sugar.
Oh, okay. So much information. Oh, okay.
And you also want to check and make sure you drew up the correct amount of insulin by checking with another person. So you want to check with me?
Yeah.
It should be at 2.
Let me check real close. Oh, yeah, that's 2.
2? Okay.
2.
Then you pull the syringe out. And make sure you have an extra alcohol swab with you as well, so you can clean the injection site. Okay?
For us to clean it, okay? Because I can't get bacteria in there.
Yes, you don't want to get any bacteria in there, because you don't want to get an infection.
Oh, I'm so nervous. My first injection of insulin.
It'll be okay.
Alright.
So I'm going to inject you in your abdomen, meaning your stomach, okay? Okay. I'm going to pinch, and I'm going to wipe. And it's going to be really quick. See? All done.
I didn't even feel it. I didn't feel it. That wasn't bad at all.
See? I told you it wouldn't be bad. And make sure you secure the needle.
I can do that every day. That was cool. Thanks, nurse.
Thanks, Nurse Jasmine. I think I speak for everyone when I say I feel so much more aware of how to prevent myself from getting type 2 diabetes. Well, thank you for tuning in to 7030 Medical Evidence. I'm Sally Novolog. Stay healthy, Concorde.
Where the day flows only time, and who can say if your love grows as your heart shows only time. We gotta
Action.
Welcome back to 7030 Medical Evidence. Here we have Stephanie Mock, our lab technician. How you doing, Stephanie?
I'm doing well, thank you.
Good. She's going to be discussing labs and diagnostics with us today. We also have our...
I was like, we got a new puppet.
Thanks, Nurse Jasmine. I feel so much more aware of how to prevent myself from getting... I was going to say contract. Thanks, to diabetes. And I think I speak for everyone.
Let's recap.
You said the basics.
She's not looking at me. She's like, yeah.
On the other end, if your sugar is too high, you can suffer from hyperglycemia. And
Percentage of sugar that's attached to your hemoglobin. The the higher your blood sugar level.
can you tell us something about that random glucose test?
Thank you, Doctor.
One. Action.
Just remember, normal blood glucose levels. If your blood glucose test comes back 100 to 100, you're stupid.
Action.
Just think, if I only want to check my...
Alcohol. I slowly started having visual problems. Didn't think much of it. Come to find out, I had diabetic retinopathy. Weed, alcohol, you call it, you know it. Everything. Started having these visual problems. Thought it was nothing. Come to find out, I'm a diabetic. I developed diabetic retinopathy.
And diaphoretic, which is sweating.
Type 2 diabetes.
Well, thank you for being here, Officer Martinez. It's a pleasure having you here. Diabetes type 2 is the most common form of scratch that.
That, Miss Novolog. Thank you for letting us in your home, Dr. Heigl. To discuss... What was I saying again? Thank you for that, Miss Novolog.
No.
I heard you laughing, stop.
Go.
One. Action.
Okay, so... Oh, I forgot.
Action.
Yes, you must eat healthy. Instead of fruits and vegetables, then you pull the syringe out. You want to cut now?
Wow, that was a lot of information.
It sure was. But just remember the basics.
Eating right and exercising is the #1 way to prevent diabetes type 2.
That's right, L-Dub.